As we reported earlier, coronavirus cases are skyrocketing across some parts of the nation. Joining us now to discuss some of the latest COVID-19 developments is Dr. Tom Frieden, former head of the CDC and current president and CEO of Resolve to Save Lives, an initiative of vital strategies. Dr. Frieden, good morning.
Good morning.
Let me start with the news this week. The White House announced that it was having hospitals no longer report COVID information to the CDC, instead bypassing them and going directly to the Department of Health and Human Services. Why is that alarming to you?
Well, I think we have to see how that plays out in the coming days and weeks. They're changing horses in midstream, and they say it's going to be better. So let's hold them to that and see if we have real-time information that's more accurate than we've been getting so far. More importantly here, we have one enemy. The enemy is the virus, and the more we're divided, the more the virus can conquer. We're seeing now the U.S. as a laggard. We're seeing deaths every 15 minutes. We have 5 deaths in the U.S. We have over 1,000 infections every 15 minutes. We're a global outlier. We've got one of the highest death rates in the world, and it's increasing. But it's never too late to improve the response and do better.
Dr. Frieden, you and 3 other former heads of the CDC authored an op-ed in the Washington Post this week, and I want to read a little of what you referenced. You wrote, their sound science is being challenged with partisan potshots, sowing confusion and mistrust at a time when the American people need leadership, expertise, and clarity. What is the message that you want going forward towards lawmakers and politicians right now?
We need consistent messaging. We need to follow the science. Follow the 3 W's. Wear a mask correctly, wash your hands, watch your distance. We need consistent messaging. Masks are important. Contact tracing is important. Testing is important. Staying home is important. But no one thing is going to control this virus. We need a science-driven, comprehensive, coordinated attack on the virus. That's the way our kids will be able to go to school in the fall. We can go back to work, our economy can recover, and we can save tens of thousands of lives. Right now, the estimates are that we will have over 200,000 deaths in this country within the next couple of months. This doesn't have to be. It is not too late to do a lot better than we're doing now. We need to get on the same page, track what's really important, and work together while we stay physically apart.
Very quickly before we let you go, you mentioned our children and going back to school. The CDC is going to have some new guidelines out. What are some of the things that we need to see to get our kids back in the classroom safely?
First and foremost, what's going to facilitate kids getting back to school is less COVID in the community. Where COVID is exploding in a community, it's going to be difficult, if not impossible, not just to open schools, but more importantly, to keep them open. If we rush in too fast, as states in the south of the U.S. did about reopening, you'll have to step back. We want schools to open and stay open as safely as possible. That means driving the levels down in our communities with mask wearing, distancing, hand washing. Bars need to be closed anywhere that there's lots of spread of COVID, and indoor dining needs to stop. So there's lots of things that we can do, and schools can prepare as well.
I was going to say the same messaging that we've been hearing. Dr. Tom Frieden, thank you. I think I called you Friedman earlier. We appreciate the time. Jeff?